to the internet. And this one also poses a very pressing challenging to our society. And on the other hand, we see many even though the vaccination available to the whole nation, but many people still are hesitant to get the vaccination. They have different reasons, maybe physically disabled, or they have a long distance to the vaccination site, or they just religious belief or some medical issue, they cannot get the vaccine, or just the people they're psychologically didn't accept the vaccination. So there are a bunch of the factors behind the vaccination hesitancy, but in this study, we are trying to find any association between the misinformation on the social media network and also the vaccination hesitancy. There is another reason why I want to present this research is in our previous journal club, we mainly focus on modeling the infectious disease. But my understanding, infodemics is also a kind of a disease spreading on another type of the virtual network. So this one can give you some ideas how we do math modeling or interpretations of the pandemic or the infectious disease happening on the social media. To understand this complex network, this study, they utilized a comprehensive approach. They analyzed the data from social media platforms like Twitter and Facebook, and also they have the statistics from the CDC, and by examining both the spread of information and the vaccination rates at both the state and the county level, they want to find some potential correlations and the causations. And here are some data. Here are some data description. Like this is an independent variable. They are mainly from the Twitter. They got 55 million tweets from COVAX network. For each tweet, they can extract their geolocation by using a library called Carmen. And from that, they got 1.67 million users across 50 states. And they also have a 1.15 million users across over 1,000 counties in the US. And then they want to identify the information. So I went to their supplementary document and they figure out how they process the misinformation identification. So here is a sample tweet from Robert F. Kennedy, and he's also a candidate of the next presidential election. You can clearly see he is kind of against the vaccination with a link. And this link is from children'shealthdefense.org. You may know this organization or this website is a kind of against vaccination. So for this study, they first figure out if there is any tweet, they have some keywords like vaccine, vaccination, or COVID, and they will summarize all the information as a Twitter database. So this is called the COVAX project. They have all the Twitter ID, and you need to hydrate or extract information and apply the filter so that you can get a collection of the tweets. And those tweets are all about vaccination and COVID. And then you can find if there's any hyperlinks in that tweet. For example, like this one, Robert F. Kennedy, he shared a link from Children's Healthdefense.org, and also this hyperlink or this website happened to be on the list of the misinformation, and this list is called Media Bias Fact Check. And if that happens, we will say, oh, this information it's a biased information. And in total, there are about 674 low credibility sources. Those means this number of the links spreading the misinformation on the social media network. And I then graph this map to help you to visualize where those misinformation happen on Twitter. So the darker the color means the more tweets sharing misinformation in each county. You can see maybe we have some counties over here. I believe this is in New Mexico, but we also have lots of the counties spreading in the eastern coast or the eastern part of the US. We can set up a different threshold of the number of the tweets in each county. The reason is we cannot find all the geolocation for each tweet, and there's never a way that you can find all the tweets shared or originated from each county. So the study, they give us a threshold saying if we can find 10 tweets in a county, and if one of them is a misinformation related tweet, and we will assign a Twitter misinformation percentage to that county. But this threshold is 10, which means only the sample size is 10 for each county is relatively small. So this study, they use 100 instead of 10 in this study. I will interpret this one as there are 10 tweets originated from each county. Sorry, there are 100 tweets originated from a county, and at least one of them is about the misinformation, and we will count how many of them or how many percentage of the tweets they are misinformation. So this is how I have this map, and you can see not all the counties have misinformation statistics. This may give us some, to my opinion, this may give me some question on this study, because this is not a comprehensive or population level coverage. Here is another thing I found from the another study, also from the same author. They might use the same type of information to create this graph. And here you can see the color represent if the information itself is more liberal or more conservative. And also the y-axis, you can see if they are low credibility or high credibility information. You may see they call that a smile shape or V shape. Most of the information shared, they studied, they are in the low credibility, but you can see there is a separation here, maybe liberal information. Both the liberal information and the conservative information, they also share some reliable content. However, if you are more conservative, if a link is more conservative, they are more likely to share a high credibility information, which is different than this is the high misinformation associated with a high conservative in this area. So this is the same as our first initiative. And here is another type of data, dependent variables. They use the vaccination update rates at the state level, and also have the vaccination hesitancy rate. And this data is from the Facebook Delta group. And how they conducted the survey is by asking questions to the users of the Facebook. And if their answers to these two questions are yes, or have some their insights, and they will include there might be some vaccination hesitancy happen in that county. So those two questions, these two questions, if you have already received a COVID vaccination, or would definitely probably choose to get the vaccination in the future. So it's a combination of the fact and also something might happen in the future. It's about the people's opinion about getting the vaccination. So the vaccination rate is the fact, means how many people has been administered the vaccination. But on the other hand, the vaccination hesitancy, this one is about the people's opinion or psychologic opinions on getting the vaccination. And also for the vaccination uptake rates, this one is available at the state level, and vaccination hesitancy is available at the state and county level. Other than that, they also have a lot of confounding factors, including poverty or age, race, land use type, and political affiliation, like the number or the percentage of the voters who voted for Donald Trump over the 2020 presidential election, and some religion factor and unemployment rate and population density. Here is a more detailed definition of each socioeconomic factors. I think they are very typical. To analyze this research, they have two scopes. One is to find association, whether there is a relationship between the vaccination hesitancy and the online misinformation spreading pattern. And the other thing they want to figure out if there is a causality between the time of the misinformation posted online and also the vaccination uptake rate. So there are two aspects of this study. We will jump into the results. The result is pretty straightforward. Even by using a simple linear regression, you can see the strong connection between misinformation sharing and the COVID vaccination uptake or vaccination hesitancy. And here on this graph A, you can see the x-axis, they are online misinformation. The higher the number means the more misinformation spread in the county. And on the y-axis is the vaccination uptake rate. So you can see there is a negative correlation. The more misinformation shared in a state, the fewer people getting the vaccination. And the color here represent the political affiliation. Here is in Republican states, and here is Democratic state, and here are the states in the middle, and the size of them means the population. And here is another association in image B, which is online misinformation percentage and also vaccination hesitancy. And this is a possible correlation, even though it's not very straight, but it's not very, the slope is not very deep, but you can still see this possible correlation. So this is one of the most important conclusion from the study, which is the misinformation about the COVID vaccinations. It's associated with higher vaccination hesitancy and a lower vaccination rate. In this study, they also find some other interesting correlations. For example, like the Black residents, they show a positive correlation with the vaccination hesitancy. However, the Hispanic or Latinx group, they have a negative correlation with the vaccination hesitancy. And another thing is about the poverty. If the percentage of the residents below the poverty line, and they have a more positive correlation with the vaccination hesitancy. But this study here is based on the state level, means the number of the sample is only 50. And the authors, they dive deep into the county level analysis. Here, the county is about 548. The reason the number of the counties is not as many as you expected is because of the availability of the misinformation on the Twitter network and also the availability of information on the Facebook survey. But just based on those 500 county level information, we can still see a clear pattern on the online misinformation and the vaccination hesitancy, and also those trends are separated by the Democratic counties and Republican counties. But I will say both of them, they have a positive correlation but among the Democratic counties, maybe this correlation is more obvious than the Republican counties. Here is another similar analysis. This one is association between the political affiliation and the vaccination hesitancy. More Republican voters in the county, more hesitant. So this one is I will say it's a strong linear correlation. Another way to visualize it is is by a geographic map. Here, the brightness of the color means the vaccination hesitancy. More bright means more hesitancy. Here, Wyoming is state standout. They have higher hesitancy rate than the majority of the states in the country. The size of that means the number of the vaccination uptake rate. And you can see the size of the Wyoming is even larger than the rest of the states, which means their number of the which means their hesitancy on getting the vaccination is larger than the rest of the states. To analyze the causation of those variables, the misinformation and also the vaccination hesitancy, they ran model called creature causality analysis. And in this one, their conclusion is misinformation does help forecast the vaccination hesitancy. And at the county level, you can see this trend more clearly. And here I have a screenshot of those county level results. To analyze, I'm not an expert in this analysis, but my understanding is if you compare this model and this null model, if most p-values or they are lower than a certain threshold, you will say maybe the misinformation spreading online has some time-dependent correlation with the vaccination hesitancy. And in this, just based on this graph, the authors, they conclude there is a lag around 2 to 6 days from the misinformation posted in a county and to a corresponding increase in the vaccination hesitancy in the same county. What I'm looking at here, looking at their result, I found maybe from day 2 to day 6, and you can see maybe this one is statistically significant. Day 3 is okay, and day 6 is okay, but I didn't see significance in day 4 and day 5. So maybe this conclusion is just a range of them. It's just a range, and maybe there are a couple of days they are not statistically proved, but we can still see the general trend is after 2 to 6 days, you post the misinformation on the Twitter network, you can see the change of the vaccination hesitancy rate. To conclude, I will say this research, they really unveil some striking findings. There was a significant negative correlation between the spread of misinformation and the vaccination rates. And also, this effect is more pronounced in counties with a Democratic majority. So I will say this is a very complex intertwine between political affiliation and susceptibility of the misinformation. And they also conducted the analysis called the greater causality, and indicating there is a relationship where the information, there is a direct relationship between the misinformation and also the vaccination hesitancy. So I will say those findings are very critical because they can help us to target which location might need more attention to have the truth and also help us to tailor-made some policy in certain counties or the states. This is some extension of this study. And this one will cover some misinformation and how this type of analysis can help us in modeling some infectious disease. For example, like in what kind of where you can grab the social media information. In this study, they got the information from Twitter or X, and they can also get some Facebook survey information. I also know some research, they are collecting data from Instagram or YouTube, or have some television viewership analysis. For example, if a county has more viewership of the Fox News, maybe there is a difference in those counties with the vaccination uptake rate. And to process those data, there are different ways. Like in this study, they use data scraping and also Twitter data hydration. But in some other analysis, maybe we can use the large language model to analyze the contents of each tweet. Or maybe in the future, we can use generative AI to help us to classify the information if they are misinformation or reliable information. And also there is another way we can analyze those type of information is by using the network modeling, because the social media is it's another structure of the network. By using the network science and network models, it can help us to understand the spreading patterns of those information in each network. Of course, we can embed some typical epidemiology model or compartment models into the misinformation study. There are a couple of the examples you can refer to, but there are also some challenges for sure in using the social media information to study the public health issues, like the data source and data quality. Are there any missing counties? Like in our study, we only selected about 500 counties, not covering the entire United States, which has about 3,000 counties. And there are also some sensitivity analysis. If your model only cover a small portion of the entire population, well, how reliable the result it is. And also of course, we will concern on the privacy of those social media information. Here, I will give you another look at the sensitivity just by picking up a different threshold of the misinformation spreading in a county. You can see the number of the counties just by changing the thresholds will give you different number of will give you a different result. For example, here, if the threshold is 10, which means there are 10 geolocated tweets in each county, and you will get 1,200 counties. However, if you change the threshold to 50, you will get about 900 counties. If you change the threshold into 100, like what we saw in this study, they will eventually get about 500 or 600 counties. So there is a change on the sample size. And here is another example on the data reliability, because the data they claim, the study they claim they use the CDC vaccination data. However, when I went to the CDC website, when I first read this article about 2 years ago, I found some data anomaly. For example, this is the county in Georgia. It's over here. They are very standout in terms of the vaccination uptake rate. They say 99.9% of the population, they have the fully vaccinated. However, if I went to the local vaccination website in Georgia state, you will see only maybe 70% of the populations, they are vaccinated. So there is a large discrepancy between the CDC data and the local vaccination data. This one gives me some concern on the data reliability of this study. Probably the authors, they have processed the data or cleaned the data in advance, but I didn't see that description in the main content and also in the supplementary documents. So in today's discussion, we only have about half an hour, but you're welcome to discuss all of them or just to pick up two. So those questions will asking you about your personal experience on the infodemics, and also do you have any suggestions on using the social media or some misinformation analysis in your infectious disease modeling? And do you think there are any other methods or any other interesting data you think you're interested in learning? Thank you. I will get back to you, Sylvia. Thank you.